Welcome everyone. Today I'm honored to be speaking with Priyanka Rai, one of the health and policy leader of Federation of Ethnic Communities Councillor of FECCA based in Canberra. Thank you for having us, Priyanka.
You're welcome.
To start off, I would love to hear a bit about your journey. What motivated you to follow a path in health policy and equity, both professionally and personally?
Thanks. It was actually a personal journey. So I moved to Australia and was working as a consultant, and I got diagnosed with type 2 diabetes. And I was very young at that point. I was only 28, and it really triggered my interest in the health system. And my diagnosis only came after like a long journey with fertility, and I began by working with an organization called Consumers Health Forum, which is the peak body that represents health consumers in Australia, and that's what got me on that journey. And since then I've worked across a whole heap of chronic conditions, like dementia with Dementia Australia, chronic pain with Pain Australia, type 1 diabetes with the Juvenile Diabetes Research Foundation, JDRF, now Breakthrough T1D. So I've been on this whole trajectory of trying to understand health inequities where they exist and improving access. So that's kind of transformed into my career now. And now I am the Executive Director for the Australian Multicultural Health Collaborative, which is an initiative that's looking at reducing health inequities in our multicultural communities.
Wow, it's clear that you're really passionate about your work though. Yeah. Now let's talk about more of health equity. How do you define health equity in practical terms?
So practically speaking, it's whatever it takes to improve your health outcomes. So, what does it take to ensure that you can live your life and have good health, good mental health, good social well-being, and all of those are linked to each other. And that can mean different things for different people. So for people who are born in Australia, grew up here, understand the health system, it can mean growing up understanding that the GP is the point of access to care and knowing that you go to your GP with your first concern. But if you've moved here from a different country where English wasn't the first language, healthcare was mostly privatized, where you're used to paying out of pocket, you may not know that you have to go to a general practitioner first to access healthcare, or that you can go to an emergency department to seek emergency care. So understanding about that health system, so inequities creep in. So for people who move here and don't understand what the access pathways look like, there's a lot of barriers, and some big common ones are the ones that lead to inequity in health outcomes for people who move to Australia.
Yeah, that makes it really clear, and that was my next question to ask. In your view, what systemic barriers do you think are most urgent to address when it comes to achieving health equity?
Yeah, so in Australia, it's obviously a very multicultural community. Yeah. More than 50% of Australians were either born overseas or have a parent who was born overseas. So there's a lot of diversity across the health spectrum. But some of the big challenges you face is access to information and language. So being able to get health information in a language that you understand and you can absorb that information. Another big challenge we face is the lack of data on what does health ethnicity look like. So we still don't have health services that are, or even our census doesn't collect information at that granular level around, what are our health outcomes across different ethnicities. So that is a big challenge. We have challenges in actually engaging and reaching these communities. So being able to access, grassroots that tap into these communities are not regularly consulted. So there's a whole spectrum of issues that contribute to these health inequities at the moment.
Thanks for sharing this. Moving forward, which policies do you think have had the most measurable impact on the community?
Some of policies that are working really well, or actually have the potential to work well, are access to interpreters. So there is a free interpreter service that health practitioners can access, but awareness of that and the actual access itself isn't very high. We've found that targeted approaches to reaching multicultural communities can work. So, for example, like the Embrace project, that's mental health, particularly for multicultural communities. So where that focus and initiative is taken to actually enable access and working in tandem with these communities to make sure that the resources that are developed are aimed at them, we find those are the approaches that work really well.
Given that, how do you think we can better use those data to measure progress on equity in healthcare?
So, I mean, the foundation of collecting the data is like, if you're not measuring something, you're not going to know if it's working or not. So, I think the biggest challenge would be actually engaging these communities and making sure that they're a part of the co-design process, so that they are actually involved in deciding what data is collected and how it is used, and that they are also part of the evaluation of what are the programs that are working. So it's not just at the grass tops level, but it's actually going down and actually measuring what's working within community, and that community feedback is really, really vital.
Then, given that, what kind of strategies do you use to get those community engaged?
I think what we've got to understand about multicultural communities is the diversity, and there's a lot of organizations that work with them, at that grassroots level. So FECCA and AMHC are member-based organizations, and we have hundreds of organizations that do a lot of that work and support. And this is what we also saw in COVID, where communities didn't trust information that was coming from the government because it was changing so rapidly. They already had existing channels and community champions who they trusted, and from whom, when that information eventually was came through them, that's where the effective the change in community attitude happened. So I think the most important bit is recognizing and working with these grassroots organizations.
Interesting. Yeah, thanks for the perspective. When it comes to risks, what do you think are the risks of relying too heavily on those data when it comes to people-centered issue?
So the biggest challenge with data is if it's not collected properly, and if you don't have that granularity in the data where you can actually, for example, where you don't even know if you're collecting ethnicity data and you're relying on very top level issues, you won't know where the problems lie. So data can tend to, if it's not corrected properly, it can tend to obstruct from what the real problem is. Plus, it can also be, if you rely only on data as an entry point, it can be very dehumanizing, because what we find with health issues and access is they are all often very complex, and you can't just use, say, data around access won't tell you what are the other issues that are impacting. Then one of the biggest issues for migrant communities and multicultural communities can be social determinants of health. For instance, inability to access GPs, or multicultural communities don't use the GP that often. There's a large out-of-pocket cost that's associated with going to the GP. So cost is a big factor. So there's the data alone can't give you a full picture, so you've got to ensure that even the data that you're collecting reflects community sentiment.
Yeah, those are valuable perspectives to consider. Now, in your view, what are some effective ways that healthcare organization can improve cultural competency among their staff?
So training is obviously, a very big important one. So we want to see more training of healthcare practitioners, or for the healthcare workforce, particularly around cultural safety, cultural appropriateness, especially as we know Australia is going to continue to be an increasingly diverse community. So that cultural competency training will be really vital in ensuring that communities continue to access important healthcare and they feel like their needs will be met.
That makes a lot of sense. Then Speaking on leadership, how can leadership play a stronger role in supporting those effects?
So I think, especially when we're trying to have something as big as cultural sensitivity, cultural competency built into workforce, leadership is vital. Like these, healthcare workforce is already so pressed. They have 100 things that they're managing. They're always time poor. So without that prioritization coming from the top, it can be really hard for the workforce to prioritize this particular training and skill sets. So it does have to come from very strong leadership that's championing these causes and understands that these issues are what is contributing to a vast gap in outcomes for communities.
And what advice would you give for this leadership?
I think to be fearless, to recognize that the communities they serve need more than just translated resources. They actually need a workforce that they feel comfortable in reaching out to and approaching and discussing their concerns with. So it's more about making sure that that information isn't just available, but is also something that people can access readily.
Yeah. That really gives a very clear picture. Building on that, how can a healthcare system ensure that diversity and inclusion can go beyond training and are reflected in everyday practice?
So there's an opportunity we have, right? Like even with the health workforce in Australia, a lot of that health workforce itself is multicultural. So there is the opportunity to have bilingual health workforce, so people who can speak to consumers from a particular background. So there's a lot of potential, and I think the main thing we've got to understand is that our current approaches or approaches we've used with general population won't necessarily work with multicultural communities.
Looking ahead, what is one change that you would like to see in public health general over the next 5 years?
I think the biggest one that would make a real difference would be that ethnicity data collection across the health spectrum. So when we start understanding where these communities are, where they're coming from, what are the issues that are overrepresented in these population groups, then we can get a better picture of where to push our resources. So right now it's just we know that the outcomes are bad, but we are not able to we don't have that granular data to tell us why they're bad and what are the issues that are affecting it. So I think that data collection will be at the heart.
Which is the powerful point to get all this right data. Yes. Now, Priyanka, speaking on communities, what is Australian multicultural plan to communicate with the CULT community?
We want to work with more and more organizations that are at the intersectionality, at the interface of, they may be providing a different service, but health issues always pop up. So we want to hear from these grassroots communities, what are the issues that your multicultural communities are bringing to you, and then we want to be able to raise those up the chain and get targeted funding, targeted resourcing to meet those needs of the community. And the work that you are doing is really important in that, it's being able to reach those communities through media and channels that they are comfortable with, that they're familiar with. So it's for us, it's really important to work with community partners in building those community solutions.
Priyanka, as you know, My Care Network as a platform media for CULT community, how it can assist your healthcare plan?
So for us, we communicate through our membership. So we've got members that are based across Australia who we regularly reach out to try and understand what the issues are through them. And so one of the main things is we don't want to duplicate work that's already happening. So we don't want to bypass our members to try and reach their community. We want to go through them. So I think the strength of the collaborative is actually it's membership based, really.
And my last question would be, what advice would you like to give to young professionals who want to make a change in public health, public policy?
I think the biggest advice would be to go out there and engage with these communities, have those consultations, understand from their perspective what the barriers are, because it's really hard looking at it from from a system lens, we are working almost within the system, and the people we're trying to reach are the ones who are cut off from the system or can't find a way in. So we won't be able to design the solutions from sitting within the system. We have to go out there, we have to speak to these communities to try and understand what it is that they need.
Thank you so much, Priyanka, for having us and on spending time of speaking on such a meaningful topic on public health and health policy.
Likewise, thank you for the opportunity to speak with you.
Thank you everyone for watching.